Alzheimer's disease is a kind of dementia where there is a gradual decline in all the functions of the brain. The functions which are immediately affected at the beginning of the disorder are what we call cognitive functions. So, cognitive functions are like attention and concentration, memory, your visuospatial orientation, your language, and what we call executive functions, that is problem solving abilities, planning, organizing, prognosticating. So all these functions are gradually affected and there is a decline in all these functions. So it is more than just a memory loss, though the memory is the easiest way to kind of check whether the person is developing dementia or not. So what happens in Alzheimer's, that there is a mainly loss of recent memory. And particularly what we see is there may be loss of episodic memory. So for example, if I ask the patient, what did you have in the morning for breakfast? He may or may not remember whether he had the breakfast or not. And if he remembers that he had a breakfast, then he may not remember what all things he had in the breakfast. Similarly, if I ask him, what did he have last night for dinner, or who had come to meet him, he may not remember. So the recent events, which otherwise we don't have to make any efforts to remember, what we call episodes, the events, whatever is happening in our life, we automatically remember. But people who are developing Alzheimer's disease, this recent memory gets affected. So there is a gradual decline in recent memory first, and then later on, as the disease progresses, even the other memories get affected. So usually in majority of the cases, it occurs after the age of 60 years. And higher the age, more the age, higher the chances of developing dementia. So for example, between 60 to 65, if 1 out of 100 people have a risk of developing dementia, between 90 and 100, 1 out of 3 people will have a risk of developing dementia. So there is something what we call normal aging, where our cognitive abilities gradually decline. But more than that, there is a decline in recent memory. And that is the hallmark of Alzheimer's disease. Now, unfortunately, nobody knows why people develop Alzheimer's disease. But what we find that there is a gradual degeneration of brain cells. So certain parts of the brain starts degenerating. And as a result, the patients have decline in their cognitive functioning, like attention, concentration, memory, visuospatial orientation, language, and executive functions.
And doctor, are there any medications available for treatment of Alzheimer's?
Unfortunately, because we do not know why there is a degeneration of these cells, we do not have any medicines at present which can kind of reverse or prevent Alzheimer's dementia. There are some medicines which are available, which we use, and it is claimed that they gradually slow down the progress of dementia. So there are various factors, and one of the things which has been said is that your cognitive reserve. So suppose I am 70 kg, which is my normal weight. And if I start losing my weight, and less than 50 is not, means it's an illness. Then when I lose 20 kg over a period of say 2 years, I'll be less than 50. But instead, if my weight is 90, and then I lose 20 kg, I'll come to 70. So this is what we call reserve. say if I have a bank balance of 1 lakh rupees and I stop earning and I keep on using my bank balance 10,000 rupees per month, I will last for 10 months. But instead of 1 lakh, if I have 10 lakhs, then I will last for 100 months. So there is a principle of what is called as cognitive reserve. So better cognitive reserve. And to have a better cognitive reserve, what we need to do is cognitive exercises. So all kinds of brain exercises improve the cognitive reserve. And if you have more cognitive reserves, when there is a decline, you are less likely to be affected in your day-to-day life. Yes, there are a number of exercises. So say, for example, if I want to build up my muscles, then I'll do the weightlifting or running, all kinds of exercises. Similarly, there are brain exercises. So anything which stimulates the brain is an exercise, and it has to be something new. So it's a new learning. So for example, I'm not a dancer. So I start learning a new form of dance that will stimulate my brain, and that will remain as a cognitive reserve. If I learn a new language, that is stimulates my brain, new connections are formed, and that will remain as a cognitive reserve. Similarly, there are exercises like Sudoku or crossword puzzle. Now, all these require brain stimulation. You have to really kind of scratch your brain. And whenever you do these exercises, your brain function improves. So there are similarly number of exercises which improve your attention, concentration, memory, visuospatial orientation. Say, for example, if you are going to office, either walking or by car, every day go by a new route. There was one very interesting study about this cognitive reserve that they studied. There is an area of the brain called hippocampus. And the size of the hippocampus, bigger the size, you have better kind of memory or cognitive functions. So they did this study in taxiwalas of London taxi drivers. So if you see the London bus driver, they have certain size of this hippocampus because they follow the same route for years together. While taxiwalas use different routes.
Right.
So every time there is a new learning, and their hippocampus has a bigger size and they have a better cognitive reserve. So in short, anything which stimulates your brain, whether it is singing, whether it is dancing, whether it is learning a new language, whether it's a new activity like photography or crossword puzzle or Sudoku, anything which stimulates the brain. So all kinds of cognitive exercises, and there can be emotional, like there is a game called Scruples, where you have to guess what that person do in a given situation. So for example, you have to guess, suppose they ask you that Dr. Nilesh Shah is walking on the road and there is a 100 rupee note lying on the road. What would he do? Whether he'll pick up the note, or whether he will leave the note as it is, or whether he'll pick it up and give it to some poor person. And you have to guess that what I will do and whether your answer will match with my answer. So it's a kind of guesswork. So again, you are stimulating the brain and you are thinking about various possibilities. So these are kind of higher functions, what we call higher cognitive functions or executive functions, where planning, organizing, prognosticating, all these, even playing cards. I tell all my patients that you play cards, and card games like Judgment or Napoleon or Rummy, you have to kind of scratch your brain to win the game. So that is also a good cognitive exercise. Very simple. Cards are available everywhere. It doesn't cost more than 20 rupees. It is harmless. It cannot damage anyone. Even if you throw at somebody, at the most, he will not get hurt. And you can play variety of games with card. So all senior citizens, I tell them that apart from exercises, if you are at home, if you are in village, you don't have access to computer, you don't have access to electricity, because there are a number of computer games which improve your attention, memory. But if you are in a village and if you don't have any access, just simple cards, you play games and it will improve your cognitive reserve.